it is explained which is explained in Uttara Tantra. So the appendix of Ashtanga Hridaya. So as we know that Ayurveda has a good thing that Ayurveda considers health and the disease both as a product of food and the lifestyle. So when if you want to maintain a good lifestyle, so a good dinacharya is required, ritucharya is required, daily lifestyle, ahara, viharas, and yoga. So at the same time, when the abnormality comes, so the branch which is included in the Kaya like Panchakarma. So there are 5 procedures called in Panchakarma. So which is helpful to the cleansing of the body, biopurification. As you know that Shetri Karna. So when any plant should be grown in the soil will be cleansed and seeds are being put into the soil to grow a good in normal and organic form. So the same way, the Panchakarma is one of the procedures, 5 procedures which involve before any disease oriented to cleansing of the body for oral medications to perform in a acute and quick reaction. So coming to the factors which are responsible for the infertility, like Jarayu. So as we know that Jarayu means old age. So, but when you come to the Charaka's reference of age factors, like Madhyama Avastha is 30 to 60 years. So we can consider that Jarayu, the stage where nowadays the infertility is coming by the age of 30 plus. All the people are marrying, getting after the settlement, after getting into the job. So they are marrying after 30 plus. So we can consider Charaka's age into now considered that Jarayu. So one of the cause, the age factor may be cause, and Chinta, worries, lot of worries, the financial worries and the disease oriented, a lot of things. And Vyadija. So especially Vyadija means like in Shayaja Vyadi. Okay. So like a lot of things, disease oriented. And coming to that Vajikarna. So as we said that it is one of the branch of Ashtanga Ayurveda. So which deals with the prevention and the amplification of the sexual potency of the health of the man and conception of the healthy progeny, as well as the management of the defective sperm, disturbed sexual potency and spermatogenesis, along with the treatment of seminal related disorders in the male. So Vajikarna mainly promotes the sexual capacity and the performance, as well as improves the physical, physiological, social health of the individual. That's main important. So nowadays in the communities, like their social health of the individual is very important. And coming to that, there are a lot of things explained in Ayurveda, like Alpa Shukra, Shukra Doshas, Shukra Dushtis, Shina. So all in the different aspects and the different concepts. So I just want not to go detail. I just want to let you how the Panchakarma involved in physiological factors and psychological factors in the present conditions for infertility management. So it's a small thing that we all know that Shukra is formed of mainly Panchamahabhutas and made up of Kapha, and it is living in all over the body. The 3 things to be main remember. You just remember these words. I'll let you talk in afterwards when the Virechanam procedures in the infertility management. I'll let you know. Okay. So we all know that Alpa, Dushta, Shukra, Shina. So all the things which explains that Alpa means Prakrutyasya Retaso. That means congenital agiospermias. And Dushta means Vata Dushta. Shina means Karanesya Alpa Balha. That is nothing but a secondary causes of the oligospermia. So these are the factors, some factors which lead to the abnormalities. So defective in the sperms. Okay. And these are some modern aspects, like especially we all know that why testicles are outside the body and when the ovaries are inside the body, like a beautiful as principles of Ayurveda. So when you read a book, principles of Ayurveda, applicability in the present scenario, like the definition tells that Saumyam Shukram Artavam Agneyam. So that it means that the testes are kept outside of the body and the ovaries are kept inside of the body. So what are the things, ideal things here? Saumyam, Shukram, Artham, Agneyam. That means that for an ideal ovarial functions, above normal temperature is essential required. In the same way, for the testicular functions, the below normal temperatures is required. As you know that below normal temperature should be 20 degrees, 20 Fahrenheit. Okay. So that's why we need to read the classical text and applicability in the present scenario. So this in the modern tells that any difference regarding the testis has an scrotum, we have some parameters like 20 Fahrenheit. But any references, yes, we have references like this: Saumyam, Shukram, Martham, Agneyam. So these are the references we can tell about them and to be practiced in the present scenario. Okay. So let me come to the main thing. Before the treatment, I just want to know to the society that first thing, oral medications, when before starting the Panchakarma procedures, most of the things we know that the factors which are required for the things like essential factors. What are the essential factors for a man? So there is a reference called Dhairyam, Chavanam, Preetim. Those are the three factors which are required for the functions of the Shukra. So Dhairya means performance of excellence. So Chavanam means ejaculation, and Preeti results in satisfaction. So this is nothing but other than a male sexual cycle. So this is a very beautiful thing which explained in the Sushruta Samhita. So Dhairyam, Chavanam, Preetim, that's the four functions of the Shukra. So in the factors which we need to consider, that the male sexual cycle, as we see the female cycle, Rutukala and Rajokala, all the things, but this comes to the male sexual cycle when these three are satisfied with the partner, so that he can have a normal functions of the semen. And coming to that, before this Virachanam, we see that all the prescriptions and YouTubes, they are read by the patients, and they come to the thing that see, there are a lot of drugs explained in a textbooks of Ayurveda like Shukrala, Shukravardhaka. So these are all the things that we should think that these are not all the things which helps in increasing of the sperm count. So I'll give you a very good examples like in my practice, I'll tell that Nagabala. So Nagabala, you all know that. So Nagabala is a drug where it is used in Vajikarna and not to improve the seminal parameters. So it has been all been proven that it will improve only sexual functions. So that and one more drug like Ashwagandha. So you know that Ashwagandha rapidly used by all the people before coming to our clinic. So we should know that Ashwagandha is a very good rasayana, but it will not increase the semen count because of its Ushna characters. More than using of an Ashwagandha for a 1.5 month, that means 45 days, definitely it leads to decrease of the sperm counts. I'll just to share some things at the end of the session. As a result, when we have been practicing in the last 4 or 5 years back, we got some patients like we'll give one prescription orally, but at the end of the session, they will see that YouTube or somewhere, some X person, that Ashwagandha is very good for helping in a sperm count. No, it will help in only in the Vajikarna, sexual parameters will not be increased. Only thing that it will enhance your sexual characters to participate with each other, and which will improve only erectile dysfunction. Like the same way when compared to Kapikachu, and the opposite because of its characters, like and Gokshura, as previously the doctors has been explained. So Gokshura will help in the semen count, and coming to the things is because of its property, it will help in the erectile dysfunction when longer uses. So these are things which we need to be very clear regarding the patients, how they are using. oral medications before coming to the Panchakarma procedure. This is called Shodhana, biopurification. We need to know that Shamana Chikitsa is followed clearly by the doctor, by the patient, so that we can rule out after giving the Uttarvasya, Panchakarma, Virechanam, Vamana, Nasyam, Rektamokshana, all the things. Somewhat we get results, and sooner after 1-2 months we get see the results degraded. That the thing is that the patients unknowingly or knowingly use the oral medications. Like example, a patient has a constipation, so they will use a Triphala. As you know that Triphala is consisted of Haritaki, Vipitiki, Amlaki. So in that, Haritaki is one of the drug which is used in Garbha Pataka, abortifications. So when the patient takes the orally of Haritaki and participates in the with his partner, so later on we can see that the miscarriage of things. So these are all the simple things, and be cautious when the before going to the Panchakarma. Because Panchakarma is a biopurification, which is the thing which has all the Vamana, Virechana, Vasti. As you know that Vasti is an Ardha Chikitsa. So when the complete whole Chikitsa, before that, all the things to be known clearly and follow the Panchakarma procedures. And here some case, like I just want to explain the Virechanam, a case we have been explained, treated with one case. So what is the, as you know that I said it previously, physiology of the Shukra. Shukra Dhatu contains Panchamahabhuta. As you know, Shukra is a Saumya. So it contains Jalamahabhuta Pradhana. So we are indicated with a Virechana Karma. So here the pathological conditions includes, in this case, a low count along with the decreased motility. So in the low count is due to the involvement of the Pitta. So as you know, the Virechana is a Pitta Anilaharanam. So we need to follow the principles of Ayurveda. So due to involvement of the Pitta, so we are indicating the patient with Virechana Karma, as it possesses Agneya Guna, which is in a reverse to the Saumya Guna of the Shukra. So that is motility, Chalatvam is the Guna of the Vata. So here the vitiation of Vata involved in the pathological of lower motility. So in order to remove the vitiated Pitta, Pitta dosha, the Virechana is administered here. So it also eliminates the Sroto Rodhana and activates a transformation of dhatus through the Dhatuagni, and most desirable Shukra, Shuddha Shukra is produced. That is very important. Shuddha Shukra is required. As we know that Shuddha Shukra thing is that Spatigavam, Dravam, Shuddham. So here things like things to be noted, like Guru, it contains like Guru Guna. So Guru Guna means the dense of the thing, and Shukra means which is white. Snigdha means moderate, viscous. We need to know the viscous of the thing. So for that case, we have to know that by doing the Virechana, we'll get a Shuddha Shukra Lakshanas by this procedure, by the mode of action, and which helps in the eliminating of the free radicals present in the microcirculatory channels of the Shukrava Sotas, which in turns refers to functions of the Shukra, and by doing this, increasing the thing which activates the Shukra and helps in the motility also, and which will helps in the Shukra Dhatu Dushtigatas and Dhatu Agnis, and facilitate for more Shukra Dhatus for increasing the volume of the count also. Here are some things we made it very clear that in a thing for a mode of action, little bit as per my knowledge, I just want to share. So when Virechana, as we know that thing Virechana is yes, but in the modern science, we need to know how the Virechana is having the mode of action. So when I said that all the Soto Dushti channels will open, so with the improper nutritional assessment and the behavior of the drug, so increase. So by these things, the LH will hormone will stimulate and will increase the 7 count. So here is one case presentation. So he was the thing. We can see that before and after results. So this is the way we do Virechanam procedure. And coming to the thing like Vasti, Vasti is an Ardha Chikitsa. There are a lot of things like Anuvasana Vasti, Niruha Vasti, Apana Vasti, and Uttara Vasti. So as a different things in explained in Acharyas. So I just want not to go deep because the time is letting more. So I just want to help know the what is the thing which happens when erectile dysfunction. It's mainly that when you give Uttarvasi or Matravasi, it will stimulate the neurological stimulates like S in the S2 and S4 somatic neural pathway, which regulates the external urethral sphincters, and the same continuation for the penile erection. This is mainly will do Uttarvasi for erectile dysfunction. So this is some pathological conditions and mode of action where the Uttarvasi is given as per my knowledge. So I made it from different books. So it will mainly stimulates the pathway to S2 and S4 somatic neural pathways, which will regulate the urethral sphincters and continues for the penile erection. So Uttarvasi may be initiated which will initiate the parasympathetic stimulation for the hypothalamus. So this is very important for erectile dysfunctions cases. And somewhat the physical stimulations by Uttarvasi can be affected by the alteration of physical factors like stress, anxiety, depression, and which will helpful in the penile erection also. So these are some cases. I just want to conclude that. So there are a lot of things the Klaibya we can discuss, like there are Rasadhatugata Klaibya, Shukradhatugata Klaibya. So there are a lot of things. I just will conclude myself that disease which are naturally things which happens by the human beings due to the unhealthy sexual life, and unhealthy sexual life is occurs mainly due to the various physiological problems, like where a partner was a poor knowledge with a thing, fertility things. So there is no doubt that Uttarvasi will helpful in the lot of conditions and penile erections. So Uttarvasi effects on the urinary bladder, and still there is no clear known that, but Uttarvasi will definitely helps. But regarding the practice daily, so it will enhance. So I would like to thanks everyone for giving me such a beautiful opportunity, and the panel doctors and Dr. Mehdi Hassan, especially, and Sujata Gonu, our Guruji. So I would like to thanks everyone. Thank you so much. Hope you understand the somewhat theoretical to clinical aspect of mine to the in the present scenario. So thank you so much.
Thank you, sir. Thank you so much for your very practical information to sharing with our national doctors.
Now I request our Honorable Sujata Gunu Madam to present guest speaker. And ma'am is also a president for Ayurvedic Menopausal Society of India. So I request ma'am, please give me your presentation.
Thank you, Ramavani. Thank you. Good evening, everyone. Before we begin, I would like to take a moment to thank Dr. Mehdi Hassan sir for collaborating with me to interact with you all. I am immensely happy to share my bit of knowledge across the border with you all. Let's hope these inputs would be of some use to each of us today. Also, thank you, Chairperson sir, for making such sessions materialized. So, without any delay, I go to the subject. As all we know, no disease is produced without involvement of Vata, Pitta, Kapha, the three doshas. And vitiation of doshas and dhatus become the root cause of all diseases. So, treatment for disease should aim at establishing the equilibrium of doshas and eliminate the waste products. And a method of treatments are either purification, that is Shodhana, or palliation, that is Shamana. So, what are the principles of Panchakarma Chikitsa? So the depleted doshas are increased till normalization. The vitiated doshas are pacified, and excessive vitiated doshas are expelled, and normalized doshas are maintained. So these are the main principles of Panchakarma. So on this concept, Panchakarma is based on this concept. Langana, that is Shodhana and Shamana, and Brahmana, both, and it is not merely Shodhana. So hence Panchakarma are Vamana, Virechana, Basti. That is Niruha and Anuvasana and Nashya. And according to Sushruta, Raktamokshana is there, but I am not taking into this today's the lecture. So, wow, what is the next? What is the importance of Deepana, Pachana, Snehana, Svedana in Panchakarma? So, before going to the Shodhana Karma or Panchakarma, we must know about the role of Ama and Agni in infertility or Stri Rogas, because all Stri Rogas are gynecological problems are causing the infertility. That leads to the infertility. So Ama is the major cause of most diseases. There are 3 types of Ama: at a digestive level, and tissue level, and at dhatu, under this Jataragni level, and dhatu level, and Bhuta level also. So these 3 levels of Ama. Ama means nothing but toxins. Toxins formed with Jataragni Mandya. Jataragni, the decrease of the Jataragni, these toxins are formed. The Agni is the metabolic capacity of the body, not that is a metabolic capacity. So Jataragni Mandya produces the Ama Rasa Rupa Ama. Ama Rasa Rupa Ama. So that Rasa Rupa, Ahara Rasa is Anna Rasa is causing the Ama. Directly Anna Rasa that forms into the Rasa Dhatu, but it is directly Ama formation. So it is an undigested form of the Ama that causes the anemias, amenorrheas and all. That may cause infertility. And Dhatu Rupa Ama. Dhatu Rupa Ama that causes the from Rasadhatu only Atava is formed. So Rasadhatu is in Ama form. So that causes the Kshinatava. Kshinatava means Atava we can take as a hormones, as a female hormones or menstrual blood, and that is related to the ovulation also. That causes Artava. So Kshinatava means anovulatory cycles. We can take anovulatory cycles and scanty menstruation and all type of that we take a Kshinatava. And Rasasesha Ama. That is a Rasasesha Ama we can see in PCOD type of that forms the avaranas and form that Ama. So by treating the Ama itself is a cure, treatment for infertility. Sometimes it simple Ama Pachana may cause relieves the infertility and problems. So the prime importance is the treatment of root cause and correction of the Agnimandya by Pachana, Deepana, Snehana, Svedana, and before Shodhana. So what is Pachana Karma? Pachana is a Amapachana, whereas it does not increase the Agni. Agni Mandya is causing the Ama formation, but ama is not increased the pachana by pachana. It specifies the ama, it dissolves the ama, but not increases the agni. So the best dravya for pachana is Nagakesara. The drugs used for pachana, accordingly, its visheshan of doshas are in vata dosha, if ama is formed, the rasna kvata and shunti kvata we give. Shunti kvata 10 to 15 ml morning and evening. That most of the infertility is mainly due to the vata dosha, the formation of ama. So usually we give in infertility rasna kvata and shunti kvata. And if it is with pitta dosha also, there are any menstrual disorders also there in the ama, with ama, pitta dosha is there. And patola kvata, atarusha kvata, that is vasa, adatoda vasika. So that kvata is beneficial for. And if kapha dosha, ama with kapha dosha is there, and pichumarta, that is nimba kvata, and triphala kvata is very beneficial. And alpavala doshas, if doshas are any dosha, vata, pitta, kapha, any, that is alpabala, so it's very minute quantity. Then musta and parpati kvata is are prepared from shita kashaya of musta and parpata is very beneficial. So the duration of pachana is till appearance of the samyak langana lakshanas. There is a very big list of the samyak langana lakshanas, but I am not mentioning here. And dose of pachana depends on the dosha and what is the aushadha we are giving, and prakriti of a patient, and age of the patient, and that place of the patient also. It depends on all that. Next, deepana karma. Deepana karma does not assist the digestion of ama. It instead of it helps the increasing the digestion power, so that the formation of ama is controlled. So best deepana dravya is mishi. So mishi means nothing but Somf. All we know this here in it is a in a figure we are seeing. Somf is the very much beneficial for this. And it is very much useful in dysmenorrhea also. It keeps the uterus from the contracting. So so maintenance of the pregnancy or maintenance of the menstrual cycle also, it is very much important. So maintenance of the digestion power. Digestion means it is not jataragni, it is dhatu rupa digestion also. So it is a maintenance. Sometimes deepana pachana drugs only cures the infertility. So with simple deepana pachana dravyas, it gives best results. So deepana pachana karma assists in digestion of ama and helping in increasing the digestive power. Best deepana pachana dravya is chitraka. Chitraka, that is Plumbago gelanica. And next is purva karma. So after that deepana pachana, purva karma. Already the Dr. Hassan sir and Dr. Ramavani also, purva karma, pradhana karma, they mentioned that purva karmas are, the purva karma snehana is adapted first. Sneha sveda are the purva karmas, and the purva karma snehana is adapted firstly and followed by svedana karma. Later sanshodhana karma is adopted. So next, snehana karma. Sneha. What is the snehana? Snehana is a process of voliation of the body by using medicated oils and ghee externally and orally also. So Sneha refers to something that is soft, oily, lubricating. So the process of this is called Snehana. Sneha and Snehana karma. So the procedure by which Snigtatva and Vishandana Mardava, the softening of the tissues, tissue level softening is achieved by Snehana karma. So the Sneha pacifies the Vata. It imparts softness to the body. It disintegrates the accumulated dosha. So after that Svedana, liquefies the deeply after this Snehana karma, this Vedana liquefies the deeply situated doshas are easily removed by the Shodhana karma. So Abhyantara Sneha. Abhyantara, so internally what Sneha is called. The Abhyantara Sneha will give Grita, Taila and all. And this Taila is the mainly specifies the Vata. Here we must know the main cause of the infertility. Then after also I will explain what is the role of Vata. The Taila specifies the Vata disorders, but does not vitiate kapha. Here, we must cautious because infertility, most of the infertility patients are PCOS patients. They are obese. But if you again we are giving Taila, it causes the increased weight gain. We think that is the myth. It does not vitiate kapha. It enhances bala, but not kapha. So we can give in obese patient also Sneha we can give. So it is a tvacha and stirakara, and it purifies the yoni. So strictly that yoni vishodhanam, it is called yoni vishodhanam also. So, and the other Sneha is Gruta. Gruta in Vata Pitta, other than Vata, if it is mixed with Pitta disorders or menstrual related or hormonal related, that menstrual related, hormonal related, that Shatavari Gruta, Kashmaryadi Gruta, Dadima Gruta, Phala Gruta, Ashwagandha Gruta, Shatphala Gruta. These are all grutas we consume. So this gruta, so it is very much important that and this the gruta is the dietary phospholipids. The dietary phospholipids that it acts through the receptors, inflammatory receptors, and it reduces the abdominal pain, swelling of the breast, and joint pains, and improvement in emotional symptoms of premenstrual syndrome. So the dietary phospholipids has a potential to modulate the neurotransmitters and thereby the positively affect the emotional and psychological symptoms in women. So it reduces the inflammation. So it is very much important. Endometriosis, infertility causing the endometriosis and reactions, inflammatory reactions by initiation of the decrease of the prostaglandins. So next, so it is very much important to give Abhyantara Sneha for all patients without hesitating the weight of the patient. So next is Bahya Sneha. That Bahya Sneha we use as a Abhyanga. Abhyanga means application of the Sneha on body. Sneha on body, oils are medicated oils are mainly Vatahara oils we apply that. And this externally we use the whatever oils, the tvak is the main source of main seat of the vata. So our main target is vata. So bahya sneha also specifies the vata. So the main importance is under Tailabhyanga removes doshas accumulated in the microchannels by virtue of its sukshma, vyavayi guna and kashaya rasa, and vyana udana vayus are normalized. So it specifies the vata. Next, svedana karma. Next is after sneha, sveda karma. Sveda causes the dravikarana of the malas. The whatever softening of the malas, it is liquefies. The sveda karma liquefies by its ushna guna and bashpa guna, and it facilitates the movement of mala towards kosta. From where it is expelled out through the shodhana karmas. If you do the vamana karma, it comes near root, that is upward movement, and virechana karma or vasti. So whatever the near root is there, it expels out through that. So sweda karma also very much that. And always sweda karma is before Sveda karma, we must do Snehana karma. So, directly this Sveda karma is capable to remove the obstruction. In tubal block, Sneha, Sveda. Before going to the Shodhana or Uttaravasti or any this Matravasti or any Snehavastis, before going to that, Sneha Sveda is relieves the and it improves the action of the tubal block and that is Srota Avarodha, it is called, and it is indicated in all stages of the vata, kapha vata or kapha. These disorders, it is very much useful. It should always be preceded by the snehana karma, as earlier said. So next is vamana karma. This is the first main karma of panchakarma, and the vamana, the speciality of vamana karma is that vamana dravya reaches the cellular level of the body. Without digest it, it produces the sandhi shaithilya. Sandhi shaithilya means breaking down of the doshas, and that is doshas in dhatus are also disintegrated to kosta due to vyavayi and vikasi. The main actions are vyavayi, vikasi. So it is very much useful, and that kapha is the main cause of PCOS and insulin resistance conditions. We see the kapha, kapha causes the srota avarodha. So the kapha, consequently decreasing of the kapha, so increases the agneya tattva of the artava. So directly it acts on artava. So vamana dravya. So Vishnaguna of the vamaka dravya, vamana dravyas produces dahana, pachana, svedana and spreading of the drugs at a cellular level. So kapha, whatever causes the main problem is PCOS, whatever that is, and this tikshna guna of vamaka dravyas responsible for its quick action, shodhana, chedana and stravana of doshas into their own places. Sukshma guna drugs enters into the srotas and causes the visyandana, means at a disintegration of the doshas. Ultimately, doshas are directed towards the kosta. So this is the main action of the Vamana karma. So next karma is Virechana karma. Virechana karma, it is specially indicated in Pittaja and Kafaja disorders, and also in Raktaja disorders also. So indicated in Mamsa, Medo, Majja, and Shukragata Vikaras, as Sir has already told, the action of the Virechana karma, equally useful in Yoni doshas also. So the vitiated Pitta dosha present in the entire body is alleviated and expelled out. So for ovulation, we usually use Virechana karma at the middle of the menstrual cycle, after Uttaravasti, after Sneha, Sveda, Shodhana, Uttaravasti, the middle of the sun, at the time of the ovulation, or Rutukala, we call Rutukala, the Virechana karma causes induction of the ovulation. So it is very much beneficial in PCOD. So anovulatory cycles and all, it is very much, the Virechana at the mid of the cycle is very much useful. And it is very much useful in vitiated Pitta doshas, as already stored. And Pitta is mainly Artava doshas, are mainly menorrhagia, metorrhagia, that causes the infertility. It is very much useful. Virechana is the very much useful. Next, Basti. Here, I want to discuss about Basti in detail. So, Basti, all Univapas are, most of the other diseases are basically due to the vitiation of Vata dosha. Even in the Pittaja and Kafaja Univapat, there is a role of Vata being deranged. The other doshas are lame. Pitta Fangu, Kapha Fangu, Pangavo, Maladatavaha, as I said, and do not got vitiated without the basic involvement of the Vata dosha. So the treatment should be directed to pacify the vitiated Vata and eradication of the cause. This is the main principle of the treatment for all Yoni Vyapas or infertility, that Yoni Vyapas are involved in infertility. The first, we should normalize the Vata, and then treat for other doshas shall be done accordingly. So to treat Vata, Vasti is the supreme treatment. Also said it is a Ardha Chikitsa, half treatment. Vasti Chikitsa is a Ardha Chikitsa. So once Vasti is given, half of the treatment is over. If we see references regarding infertility on Yoni Vyapat, directing single baseline treatment of Deepana, Pachana, Snehana, Svedana, preceding by the Vasti, makes woman fertile. So it is very Vasti is very much important. So in Vasti, one second. So Niroha Basti. Basti, it is two types, Niroha Basti and Anuvasana Basti. Niroha Basti is a Kashaya Basti, Anuvasana Basti is a Taila Basti or Sneha Basti. So according to the place, the Pakvashayagata, again Niruha Basti, Anuvasana Basti, we give anal root, and Mutra Shayagata Basti, we this Uttara Basti we give, and Garbha Shayagata Basti, that is again Uttara Basti. And Vranagata is a local Vasti. It is called Vasti. Next, based on the Adhisthana, Pakvashaya, Garbhashaya already completed. And classification according to the different combinations, according to its action, Shodhanavasti, Srehanavasti, Lekanavasti, Vajikaranavasti, Brahmanavasti, Utkleshavasti, and Doshaharavasti, Shamanavasti also there. Its action, it is a we can say that different vastis. You can prepare the according to the wanted the whichever action we want, the basti dravya should be prepared. So next is Niruha Basti. Niruha means it is unbelievable. The action of the Niruha is unbelievable. Really, we are seeing the cases. The after Niruha Basti, the infertility patients response is very much after IVF. They went to infertility clinics and all. After all treatments, they come to us. No? After this 1 2 Niruha Bastis or other Bastis, Niruha Basti, it is amazing that it is the results are really Niruha. It is the Niruha Basti. So we use this Rajonasha, amenorrhea, secondary, that is secondary amenorrhea, PCOD, and also Astrugdara. According to the disease, we choose drugs. We choose the drugs. And Udavartini Yoni Vyapat, that is endometriosis, dysmenorrhea, and these are all in the conditions we use Niruha Basti. So this next this basic contents of the Niruha Basti are Madhu, Saindavalavana, Sneha, and Kalkadravya, Kvata, and Avapadravyas. So, for example, it is Indukanta Kvata Niruha Basti. We give Madhu 30 ml, Saindavalavana 10 grams, and Shatpala Gruta 80 ml, and Shatapushpa 30 ml, and Indukanta Kvata 350 ml. So this Indukanta Kvata, we have that Dashamula, Panchakola, and Puti Karanja. These three are mixed in the Indukanta Kvata, and this Satpala Gruta, Pipali, Mula, Chabya, Chitraka, Shunti, and Evakshara is there. So in ovarian disease, ovarian cyst, and PCOD, that is for ovulation, it is causes, Satpala Gruta causes Agni Deepana, Agni at Dhatu level Agni. So mainly Kapha is the main cause for PCOD. So Vata and Kapha. So for Vata, we are giving the Vasti treatment, and Kapha dosha, this is the Deepana Dravyas we are giving. It is a very best Niruha Vasti for this anovulatory cycles or PCOS, like that. Next, Anuvasana Vasti. Anuvasana Vasti is Taila Vasti or Sneha Vasti. According to the quantity of the Sneha we used, the 3 types of Anuvasana Vasti is there. So it rests in the cavity, so it is called Anuvasana. It is Asana, Anuvasana it is called. So the main Snehavasti is the highest dose, that is 1/4 of the Niruhavasti, that is about 300 ml, and Anuvasanavasti, that is Madhyamavasti, that is half of the Snehavasti, that is 150 ml we use. In Matravasti is half of the Anvasanavasti, that is 75 ml. Some, according to the patient, some practitioners 60 ml, they give 80 ml, 60 to 80 ml in between, they use it. Matra, according to the practitioner's wish. And this oils are used are mainly in infertility. Kshirabala, Bala Taila, Dhanvantari Taila. We use Dhanvantari Taila for Anvasanavasti, and Ksharavasti in PCOD, and Lekanavasti in obesity. Lekanavasti, I list the list the medicines, what is the Lekanavasti and all. And Palagudichadi, Vata Pitta related vastis, and Kshiravasti, Pittajadan, and Tikta Kshiravasti also, Vata Pitta conditions, Tikta Kshiravasti. So these are the Anuvasanavasti preparations. So next, Uttaravasti. As our Dr. Ramavani already detailed description has given about the Uttaravasti. It is some medications, medicines are Grutas, Thailas, I list. That is endometrial, to improve the endometrial thickness, Phalagruta, Ashwagandha, Gruta, Bala Thaila we use. And to remove tubal black, Kumari Taila, Dhanvantari Taila, Kshara Taila, Narayana Taila, Lashuna Taila is very much beneficial for the to remove the tubal block. And ovarian cyst, Sukumara Gruta, Uttaravasti is very much. And PCOD, Shatpala Gruta, Ketaki Muladi Taila is very much. And Kumari also, Kumari for tubal block. And our Kitra Kumari Taila is there. That PCOD and tubal block is very much, the results are very much impressive. And it improves the, in low AMH levels, to improve that not increases the AMH levels, but it improves the quality of the ovum. Datriadiguta, Sukumaragruta, Phalagruta, and Kashmaragruta we use. So this is the procedure. As already Ramavani explained detailedly. And some of the Basti formulation, as I said, Ksharabasti, the content of Ksharabasti are Saindavalavana 10 to 15 grams, and Chatapushpa 10 to 15 grams, Gomutra 400 ml, Amlika Phala is 100 grams, and Guda 2 Phala 100 grams. And Madhu Tailikavasti. In this Madhu Tailikavasti, Madhu, that is honey, Madhu and Taila are the main ingredients, and Yerenda Mula Kvata also main ingredient. That is the three ingredients are 300 ml, and Shatapushpa 25 grams, and Saindavalavana, Madana Phala is 1 phala. And Vaitaranavasti, the content of Vaitaranavasti is that is also Lekhanavasti, like Lekhanavasti, and Amlika Phala, Guda, Saindavalavana, but that Lekhanavasti, Thaila is not included. In this Vaitaranavasti, Thaila also, small amount of Thaila is included. So this Vaitaranavasti, our PG scholar, she is studying on fibroid uterus. The results are very impressive. So the main point is how the Basti acts all over the body. So this is the main thing we must know, that what Acharya said and what the hypothesis of the gut-brain axis. So the Basti is very unique concept developed by our acharyas for administration of the medicines through anus or other intrauterine Uttaravasti and all. So already Acharya Vakbata has explained that Vasti acts firstly on Apana Vayu, then Vyana, Samana, Udana, Prana, respectively, by controlling all 5 types of Vayu, leads to healthy body and mind. So first it starts from the anus, that Apana is the lower levels to the higher levels. So from lower levels, from anus to the brain it acts. So like it properly administered Basti acts on the Pakvashaya first, and then Stroni, and parts lower the Nabi. So drug spreads up to the Nabi. After that, the virya of Basti, that not drug, the virya of the Basti, up to the Nabi, the drug is spreads. After that, virya of the Basti spreads all over the body, like moisture absorbed from the root of the plant to all parts of the plants, tip of the plant. So that we can say that gut-brain axis, gut-brain axis. That is the enteric nervous system may perhaps best be regarded as the displaced part of the central nervous system. Enteric nervous system is that retains communication through sympathetic, parasympathetic, afferent, efferent neurons. Together with these communications, the enteric nervous system provides neural control of all functions of the gastrointestinal tract. So enteric nervous system contains 100 millions of neurons, approximately the number found in the spinal cord. Almost all the number of the neurons found in the spinal cord. And also the microbiome. Microbiome is influencing human microbiome. The another effect of the Basti. Microbiome gut-brain axis, which explains the role of the gut flora in the biochemical signaling that takes place between the GI tracts and CNS. This is the Basti acts all over the body through that. So like that, if we give Basti, it acts hypothalamo-pituitary ovarian axis and causes ovulation and all. Sir, this is on the whole, we can say that this gut-brain axis includes central nervous system, neuroendocrine system, neuroimmune system, hypothalamo-pituitary axis, and sympathetic and parasympathetic arms of the autonomic nervous system, and enteric nervous system, and vagus nerve. The gut microbiome already said. So some probable mode of action on Basti in gynecology. So this is mainly our infertility patients, how it acts. So from anal canal, gastrointestinal tract, as I said, enteric nervous system enters into the enteric nervous system, and motor cortex stimulus that causes the motor cortex stimulus, and opioid peptides stimulates the stimulates along with the cognitive receptors, and that causes the neuroaxis, that is a pain pathway, and that causes the relief of the pain, endometriosis and other udara shula and all, and dysmenorrhea, that acts like that. So it relieves action of the main action of the vata is the it causes the vata is also causes vitiated vata causes the pain. So the pain vata by giving the vasti, the pain is relieved like this. And next, anal canal, gastrointestinal, enteric nervous system, that endogenous opiates, that endocrine enters into that stimulates the endocrine system, and that endocrine, that is hypothalamo pituitary ovarian axis, that pituitary controls the gonadotrophy FSH and LH, and in pituitary. After that, the drop in the testosterone, that circulating testosterone, androgens, the main cause is in PCOD, that it acts like that in PCOD. So it and also the depression, it controls also depression, and strongly regulates the neuronal pathway, and fear response is and anxiety, depression is decreased. So relief of the pain, and decrease in the prostaglandin stimulus, and relief of the pain is takes place. This is the probable mode of action of vasti in gynecology. So factors affecting the already our madam is told about the how Uttaravasti is acting like that. And next, Nashya karma. And the last one is Nashya karma. Nashya is the drug stimulates the whatever drug we are giving nasally, the olfactory neurons that stimulates the nachos as shirasa dvaraha. This is a direct route, is nose is the direct route to the shiras. So that the drug stimulates the olfactory neurons in the mucous membrane. The trigeminal ganglionic part is also stimulated. So the most important communicating among these is to hypothalamus through the fibers from the olfactory bulb. So from hypothalamus, again, pituitary and ovarian, hypothalamo pituitary ovarian axis, it works. The in Sri Roga, Nashya is very much beneficial in infertility, and GNH, mainly in GnRH, gonadotropin releasing hormone factors. So so it is very much Nashya karma is one of our scholar is working on this Nashya karma with this Narayana Mahanarayana Taila. This is mentioned in the Yoga Ratnakara, and this in the Nasya, the 4 to 8 drops of the Mahanarayana Taila administered in each nostril for 7 days for 2 consecutive cycles after cessation of the bleeding is very much beneficial in the anovulatory cycles. With this, I concluded my topic, and thank you everyone. Please feel free to reach me via WhatsApp by the number appearing on the screen, and whenever I am free, I will get back to you. Thank you, Ananda.
Thank you so much, our very special chief guest, Professor Dr. Sujata Gunu ma'am, to give your instructional and valuable speech on Ayurvedic Panchakarma approach of infertility management. Ma'am, one of our participant, Dr. Amin, asked a question to Dr. The question is, do any recommendation of Uttar Basti for infertility management? Ma'am.
Yes, already Uttaravasti already in every condition Uttaravasti is advisable along with Niruhavasti.
Okay.
Is it question is there?
Yeah. Okay.
Yeah.
Thank you, ma'am. Thank you. Ma'am, it's a great honor to give us a schedule from your busy time. I really feel proud of you as an alternative medical care doctors. You and all of are always welcome to our country and visit our government institute and give some instruction to spread the Ayurvedic and as well as Panchakarma treatment. Thank you, ma'am. Dear ladies and gentlemen, now I am privileged to welcome a leader who have that much ability to change the society. He is our respected Deputy Program Manager, Dr. A.S.M. Kamruzzaman Shomon, our Honorable Chairperson, to give his valuable and motivational speech and closing remarks of this program. But I have little time. More than 10 Indians doctors have joined us here now. Heartfelt greetings and love from our Bangladesh Unani Ayurvedic Officers Association to all of you. Thank you. Please.
Thank you, our brilliant doctor and moderator, Dr. Akpurjaman Shoykot. Ladies and gentlemen, Assalamu alaikum, namaskar, and very good evening to all. And thank you so much to all your patience hearing with a long period of time. And I feel very honored and respect because you select me as a chairperson of this gorgeous program. Actually express my deep gratitude to our honorable and respected chief guest, Dr. Shojati Gonu, and another two international keynote speaker, Dr. Morusupalli Dilip and Dr. Ramavani, and special guests are respected Principal cum Superintendent Dr. Shaparkumar sir. This session is totally unique and clinical experience sharing session. I think it will value addition to our regular clinic practice in Bangladesh AMC Graduates Doctor Society. From this session, we know Panchakarma and Uttar Basti treatment is totally a research and clinical based treatment procedure. Thank you so much again to arrange such an international seminar on infertility issues and its management base on Ayurvedic medicine. Thank you so much, Dr. Mehdi Hassan, to take this very special initiative like this. I want this more in near future, and thank you so much of all participants who attend this seminar for a long time. At the last moment of the program, I want to again thank our honorable chief guest, special guest, keynote speakers, and today's program moderator. Again, thanks Dr. Akpurjaman Shoykot, and good night to all. Thank you.
Thank you for listening to the valuable speech of our distinguished guest for such a long time. With that, I am leaving today's program. Stay well. Thank you. Thank you to all.
Good night.
Good night.